Missouri resulted in a loss or a limited access to health care for many people with disabilities. For eligibility, adult Medicaid, now called AltNet, recipients are required to live at 85% of the poverty and experience substantial disincentives to work and be part of their communities. How would you address the Medicaid cuts of 2005? Chris.
In 2004, one of the big issues related to Medicaid in that gubernatorial campaign was the issue of recipient fraud. And many of you will recall that Governor Blunt really concentrated on recipient fraud in that election cycle. But everybody here in this room knows, as well as all the panelists up here, that the primary problem is not even close to recipient fraud. It is provider fraud. We have a $6 billion Medicaid fund in the state of Missouri, and as much as 10% of that is lost, stolen by providers, unscrupulous providers in the state. $600 million a year. Enough money to run that university over there and all 4 campuses in this university system for 15 months. That's how much is stolen every year from the Medicaid system, $600 million. The primary role of the Attorney General is to prosecute Medicaid fraud in this state. In 2006, I was the chairman of the Senate Select Committee to investigate Medicaid provider fraud in the state. We wrote tough legislation. We had difficulty getting it through the Republican House. We came back in 2007, passed the bill. It's not as strong as the bill I wanted to see passed, but it was the best bill that we could get through this General Assembly. But what it does is it gives the next Attorney General's office the tools to aggressively move across this state toward the unscrupulous Medicaid providers that are stealing from this system, to go out and gain civil awards, and other states have gained as much as $80, $90, $100 million a year, to put it back into the Medicaid system and to help fund the deficits that have been created in this General Assembly over the last 4 years.
Thank you. I need to work on saying these individuals' full names. So, Chris Costner, and I'll try to. And now it is Chuck Graham, and for Jay Nixon. Chuck.
I know that as governor, Jay Nixon is very committed to restoring the Medicaid cuts. As we went through that process, he was in my office, he was on the phone to me, constantly trying to help us block that legislation. But without him being in the Senate, which was the only place we could block things, it was very difficult for us to be able to stop the cuts that have happened. I think now people realize, and not just the people who were affected by the Medicaid cuts, the average Missourian knows that these cuts are wrong. If you take a look at any polling out there, they realize that this was the wrong move to make. Part of the problem that we're going to have, though, to be honest with you, is we're going to have the resources to be able to match federal dollars to bring back. That's where Chris Costner and I both worked on the Medicaid fraud legislation, because if there's $600 million available there, we can match that and bring that federal money back. It's a 40-60 match program. Right now we are sending billions of your tax dollars back to Washington, D.C. that's gone to expand health care in Massachusetts and Illinois and even Kansas. That's wrong. And so we've got to shut that down to be able to get those resources. And we also have to change priorities. Part of the problem with the Republican leadership since I've been in the Senate is that they are too busy trying to hand out money to their wealthy friends. Whether it's $100 million to one developer in North St. Louis City, or $800 million that they tried to hand out to a French-Canadian airplane manufacturer that didn't even move to this state. They have their priorities completely wrong in terms of trying to use your tax dollars for corporate giveaways. That's not what we're supposed to be doing in the Missouri General Assembly. The state motto is let the welfare of the people be the supreme law. And it's time that we have a governor like Jay Nixon who remembers that, and we use our tax dollars for the right things, not for corporate giveaways.
Okay, Sam Page.
Thank you. As a state representative, I voted against the Medicaid cuts in 2005 and have fought for the restoration and fought the health care cuts in committee at every opportunity since I've been elected. and I'll make restoration of those cuts a top priority of the Lieutenant Governor's office as Lieutenant Governor and as presiding officer over the Senate. These cuts were not only morally wrong, they were fiscally irresponsible. As you've heard before, in the past 3 years, we've left $1.6 billion of matching federal money that would have gone into health care in Missouri and would have helped us take care of our uninsured. And I've seen the faces of my patients in my medical practice when they stack their prescription drugs across my desk and tell me they can't afford them all. And they want to know which drugs they can get rid of, which prescriptions can they get rid of. They just can't afford them all. We have taken this state in the wrong direction when it comes to access to health care. We have the opportunity to turn this around. Now, we'll need your help. I see a lot of familiar faces here from the Capitol, and I see a lot of new faces. When we go back into session in January, we need you down there lobbying to make sure the legislature makes the right decision. We make health care and access to health care, quality health care a priority again, like it used to be.